Good evening and welcome to Arizona Illustrated for Monday, the 26th of November, 2012. I'm Tony Paniagua. A new Congress is reporting to duty next month, and elected officials in the nation's capital will be facing many major issues. One of them is likely to be addressed is familiar to many residents in Arizona: how to tackle the mounting concerns over illegal immigration. Next, we learn more about this topic from an expert in Tucson. Michael Chihak has that interview.
Lynn Marcus of the University of Arizona College of Law, thanks for being with me.
Nice to be here.
Immigration policy and law in the United States is very complex, and the idea of immigration reform thus is also complex, but you told me that it breaks down into three basic parts. Would you detail those?
Well, when people have been talking for years about trying to get through comprehensive immigration reform, what they're talking about is modifying the system for legal immigration of over, at this point, 1.2 million people a year, about changes to the security and enforcement provisions, and then something to be done about the 11 to 12 million estimated undocumented people in the country.
Let's talk about the legal path to immigration to the United States first. What are the issues there?
Most people come in through family immigration. There are also employment visas, especially for people with advanced degrees or skills. In the area of family, there are caps. In both these areas, there are caps on the numbers of people coming in, and many say that those caps need to be raised so that families don't have to spend, fathers don't have to spend time apart from their children and husbands from their wives as they do now.
And those caps are set in place by various laws that have been passed over the years, changes that have been made. And they are the political reality, but in terms of economics, there are those who say they need to be raised, not only to get families together, but because we need more workers.
It's both the social reality and the economic reality. And right now the laws are so out of whack, so far out of whack with both of those realities that the system doesn't work.
Let's talk about the enforcement provision and the security provisions in the law now. There's a component of the political discussion that says, let's secure our borders first before we talk about other reforms. What really needs to be done there?
I mean, billions of dollars have already been spent trying to secure the border, and I don't know that it's ever going to be secure enough to satisfy some people. So that when people say, secure the border first, to a lot of people, myself included, that's code for let's not do immigration reform. The only way to reform the system is to work on all these aspects at the same time.
And that's what we're expecting will happen with the impetus now from the election.
That's what needs to happen. We've been here before.
Now, the third aspect that you mentioned is what to do about 11 million to 12 million estimated people in the country now illegally. What are the issues there?
Well, some people feel that the people who don't want to grant status to the 11 to 12 million people talk about rewarding lawbreakers, and they use the word amnesty, which has become a bad word. People who advocate bringing these people out of the shadows and having them registered and knowing who they are and allowing them to participate in society say that call that a path to legalization. And so there are a number of steps that can be set up that people have to pass. Of course, they have to show that they haven't committed crimes that would bar them, but they may have to pass civics tests or tests to show that they can speak English. Well, there are various numbers of steps that they may have to take. Some people say these people need to leave the country and go to the back of the line. Well, that's not realistic. Something like that was tried in 1996, and it didn't work.
Now, a portion of the people here illegally are what some refer to as the dreamers. People who came here as children illegally were brought here by their parents illegally, and they've stayed. They've gone to school. Some of them have served in the military. They now have a new status temporarily with President Obama issuing an executive order allowing them temporary legality. What are the issues there for them?
Well, it's been close to passage, the DREAM Act, for a number of years. But the DREAM Act in its true form would allow these young people to obtain status, either by completing college or going into the military or something like that. But all President Obama has done with his administration is to halt the deportations of these people, and in 2-year increments. So there's no actual legal status. They just have a protection from deportation, and they can get work authorization. So that hasn't been fixed. That's no kind of a permanent solution. It's just sort of it's just a temporary thing, waiting for Congress to get its act together.
And that, from your perspective, would be an important component of comprehensive immigration reform?
Absolutely. And I think that should be the easiest one to get through. But again, there's a whole architecture that needs to be worked on.
And then there's one other issue involved, and it comes from the 96 law, and that's what you've called in pre-interview with me, hidden amnesty. Talk about that a little bit.
Oh, well, there's a provision that's not much discussed called registry. And if you've been here since January 1st of 1972, you can come forward and get a green card. But we don't see anybody like that now. That date hasn't moved for decades. It was the first registry was started, many decades ago. But I could see that as sort of a release valve, and I would say that the registry date at a minimum needs to be updated, even if we're talking about people who came in 10 years ago, so that people don't spend decades here living in the shadows.
And in 30 seconds' time, which is what we have left, your thoughts about the prospects for immigration reform in a comprehensive sense?
I hope that there's a reasonable prospect. I think there's a lot of reasons. There is reason for hope, but I'm guardedly optimistic because, as I said before, we have been here before.
Lynn Marcus, co-director of the Immigration Law Center at the University of Arizona College of Law. Thanks for speaking with me.
Thank you.
Millions of people are expected to be impacted by the looming changes stemming from the Affordable Health Care Act, commonly referred to as Obamacare. Tonight, we'll tell you about a group in Tucson that has been trying to provide accessible health care to many of the community's residents since 1970.
El Rio Community Health Center has been providing services to underserved populations in the greater Tucson area since 1970. And the healthcare agency has grown exponentially ever since.
This has everything from the DTaP.
I've been here for 19 years now in this position, so I've seen a lot of growth in regards to our community and our organization.
Dr. Arthur Martinez is Chief Medical Officer at El Rio Community Health Center. He says his agency provides more than 300,000 medical visits annually and strives to offer accessible healthcare to underserved populations.
There we go.
80% of the population that we serve are at federal poverty level or below, which, as you can imagine, is pretty significant then in terms of trying to provide access and services. About 50% of our population is Medicaid, and then about 30%, almost 30%, is uninsured, so individuals who have no money. And we provide service to them on a sliding fee scale.
Dr. Martinez says El Rio has been approved as an accountable care organization by the Centers for Medicare and Medicaid Services, which is part of the Department of Health and Human Services. He says an ACO refers to a group of providers and suppliers of services that work together under the Affordable Health Care Act.
Yes, what's going to happen with all of the accountable care organization? We are one of 27 organizations that have been approved by CMS to participate in an ACO. And we're really excited about that because I really think what that's going to do, as has been outlined, is that one, it's really going to put at the forefront patient satisfaction. We need to be very accountable towards patients and how they feel about the health care that they receive. That's a completely new, different type of direction.
Dr. Martinez explains that the goal of an ACO is to ensure that patients get the right care at the right time while avoiding unnecessary duplication of services and preventing medical errors.
Surprisingly, right now, on a fee-for-service type of arrangement, we get paid for seeing patients, but we don't necessarily get paid for providing the best care and getting the best outcome. And now, with electronic records and all of the movement of looking at how are we taking care of populations, not just the individual, then we're going to get reimbursed on how well we do with our patients as a whole.
According to Dr. Martinez, the changes that are demanded by the ACO structure will help both in delivering high-quality care and spending healthcare dollars more wisely.
That's going to be exciting, okay? That means development of new systems, new types of workflows, new type of staffing. We're looking at staffing at this point in time that, is unconventional. How do we design systems to truly get patients the type of care that they need and get the outcome that is really the best for them?
Martinez says El Rio is the largest community health center in the state of Arizona and provides medical services for about 1 out of every 12 residents in Tucson. And although the agency is committed to the ACO structure, the change will not come without some sacrifice.
There are specialists involved in this who anticipate that they're not going to make as much money in the future as they're making now. Okay, this new payment structure is going to change things for them, but yet they know it's the right thing to do. They're looking out for what's the best thing for the community and for the nation. To be able to improve patient satisfaction, to be able to have better outcomes for patients, and to be able to ultimately reduce the cost of healthcare.
You can find more information on El Rio Community Health Center on our website at azpm.org. There, you can also check out an extended version of our interview with Dr. Martinez.
Earlier this year, an assistant professor at the University of Arizona's College of Nursing received a prestigious grant from the Robert Wood Johnson Foundation. It is a $350,000 award over the next 3 years. And tonight we bring you a recent interview with its recipient, Dr. Matthew Gallick. Dr. Gallick, thanks for being here.
Thanks for having me.
So let's ask you first about the Robert Wood Johnson Foundation. When did you hear about this grant and why did you decide to go ahead and apply?
There is actually another nurse faculty scholar in our university, specifically the College of Nursing, Dr. Ruth Taylor Pili, and that's how I became aware of this program.
And what about the Robert Wood Johnson Foundation? We've heard about it, a lot of us have, but what is it that they do?
They're the largest philanthropic organization that deals with healthcare in the United States, and their goal is to improve health and healthcare of Americans.
Okay, so how competitive was this grant or this application process?
Extremely competitive. So there are only allowed to be one applicant from each individual College of Nursing or School of Nursing throughout the country. There were about 75 applicants. We were whittled down to about 20 interviews, and then 12 of us were accepted.
And what was that process like for you? What did you have to do specifically?
The interview was very stressful. We had to meet with their nurse advisory committee, which has people on it from throughout the country. One person in particular is Dr. Patricia Grady, who's the director of NINR at NIH, which is the nursing research piece of NIH.
All right, so this grant is for $350,000. What happens now from here?
So the grant itself, part of that money, well, first of all of the money is given out. The award is over 3 years. Part of the money is to support my research. In this case, I'm looking at genetics involved in subarachnoid hemorrhage, which is a type of stroke. And this also helps support some of my salary and allows me to help people to hire people to help me look at this disease.
And what do you hope to do with this type of stroke? What knowledge do you hope to gain, and then how can that be put to use to help other people in the future?
So as a nurse scientist, one of the things that we're really concerned with is the health outcomes of people after they have a disease. So my overall goal is to improve these outcomes. Because it's a type of stroke, these people tend to have some deficits. They may be physical deficits or cognitive deficits. What my research looks at doing is trying to prevent these deficits from occurring by looking at the genetic and biological pathways that may cause secondary injury or cause poor outcomes.
So you're trying to look at what maybe causes or what leads to these strokes and then how to deal with them afterwards?
So my research doesn't specifically look at the cause of the stroke. So we know there are some underlying factors to have this type of stroke. One is being a female in the age of around 55. That's the average person that has this type of stroke. If you're a smoker, that's a bad thing. If you have high blood pressure, it's a bad thing. What my interest is, I'm interested in secondary injury called cerebral vasospasm. It's a very complex occurrence and very difficult to treat and to prevent. So what we're looking at is different pathways that influence the cerebral vasospasm.
Okay, great. We often hear about the lack of nurses throughout the country. What inspired you to become a nurse, and why would you recommend this field to other people?
So I think a lot of us that go into nursing, the main thing that we say is we're interested in helping people. Going beyond that helping people, I was a researcher in my first undergrad, which was psychology, and I wanted to go on to become a nurse scientist and to do research in the medical field, specifically looking at brain injuries.
And why would you recommend this career? Because you're combining a lot of different things, science, research, nursing. Why would you recommend this career to other people?
It's just, you can do anything that you want in nursing. There are so many areas, and if you aren't happy with where you start out in nursing, you can just change gears and go into a different area. So for instance, if you aren't happy working as a nurse in a hospital, you could go into informatics and work it with computers that still deal with nursing in the nursing field.
Okay, and then finally, what do you hope to, or when do you hope to have some information as a result of your research and the fact that this grant has come along to help you out?
I'm hoping to start collecting the data within the next month and probably start preliminary analyses within a year, but final data will be within 3 years.
Okay, well, Dr. Matthew Galick at the University of Arizona College of Nursing, congratulations on the grant and good luck.
Thank you.
The Southern Arizona Arts Guild serves as a platform for local artists of every medium, and members are getting ready for Holidazzle 2012. It's an event where visitors can buy unique and handcrafted goods. Caitlin Harrington has that interview.
Joining me in studio now from the Southern Arizona Arts Guild is Muriel Timmons and Jean Nault. Thank you both for being here today.
Good to be here.
Muriel, I'd like to start with you. If you can tell us a little bit about the history of SAG, or the Southern Arizona Arts Guild, when it started and kind of the purpose behind it.
Okay, SAG was founded in 2002. One of our founding members, Diane Loving, is still with the group, lives here in Tucson, and she is the heart and spirit of the group. And the sole purpose is to support the visual arts. And we have got, what we try to do is provide a means for artists to, of all different levels, to further develop and expand their talents and to grow artistically. And we try to promote their work through shows and various other exhibitions, and one of which is the Holidazzle event that we're here today to promote.
Jean, while we're talking about the Holidazzle event, can you go ahead and tell our audience a little of the general information, when and where it will take place?
Holidazzle this year, and we move around every year. Holidazzle will be held at Casas Adobes Plaza at Ina and Oracle, northwest corner. It runs from Friday, the 30th of November through December 9th. And we have...
You brought some of the examples of some of the different arts that will be sold during this event. Would you mind showing us a couple of these?
Here's a painting that we would be showing at the show. And we also have ceramic work. We have woodworking, paintings of various media, various sizes, various prices. We have cards, prints, a lot of things.
And Jean, when we were talking earlier, I know that you said you have over 150 members as part of SAG. How many members will be participating in the Holodazzle event?
53 this year. It's our largest.
And Muriel, can you talk to me a little bit about, you did mention that there's quite a variety of people that are SAG members. But go ahead and tell our audience a little more detail how the members of SAG kind of vary.
Oh, yes, we do have quite a variety. We have got, well, at least one young student. He's still, I think, in, I don't know, maybe he's in high school by now, but he's a young fellow. And we just, actually, anyone who comes knocking on the door, we'll let them in. We don't jury in to belong to this group, and the reason for that is we want everyone to feel welcome if they have an interest in art. That's the only requirement, that you have an interest in a love of art. And we've got folks who have got degrees, art history, and who are out teaching, and we also have professional artists who are out selling their artwork.
And the group meets once a month. Can you talk to me about some of the different events that go on during your meetings?
Yes, yeah, we do. We meet on the first Saturday of every month, and that is also open to the public. So anyone at all is welcome to come. We have a breakfast buffet, which is kind of beside the point. The main point is the artwork. But we have got quarterly. We have every month. We have got a program, and that could be a presentation of some sort on an art technique or art history. But we also have got a quarterly critique. All of our members can bring in a piece of artwork and have our jury committee assess it. Very gentle and friendly critique, no fear critique. And we also have got an Artist of the Month contest where people who are emerging artists who aren't out there professionally can participate and get an award.
Jean, can you tell me a little bit about the voting process or the judging process so that you can also do an Artist of the Year for SAG?
Yes, the winner of the Artist of the Month contest is entered into the Artist of the Year contest, and all the members vote for that Artist of the Year. And kind of as a reward, they get a certificate, and they get the opportunity to put it on their resume that they've won an award. These are people who are shy about their art and really now have succeeded. All the members vote for that, and we include the professional members at that time, the teachers and so forth. So everybody's competing. The whole group is competing. And last year, a non-instructor, non-professional person won it. And their painting goes on our website, and it is included in the directory.
We have about a minute left, and we've talked about the Holodazzle event. But Jean, can you tell us, there are a couple other long-running shows that are also going on for SAG, is that right?
Yes, we have a show that goes on for the entire year. We change it out every 6 months. We're in the fall show right now at the Sheraton Tucson Hotel and Suites on Grant and Rosemont. And then we have a show going on until December 31st. It's at the Hilton El Conquistador on La Cañada.
Jean and Muriel, I thank you so much for joining me today.
I'm glad to be here.
Thanks for having us.
In tonight's video postcard from Ana Lata and Yuri Machado, we take you to a performance from an organization that is known as Elemental Artistry. The group incorporates acrobatics, pyrotechnics, dance, and trapeze to impress its audiences while stressing safety.
Elemental Artistry is more than a fire performance troupe. We're also a group of artists from the community that can do aerial acrobatics. We do acro yoga and acrobatic performance on the ground, depending on the performance and what's right for the audience in the venue. The most interesting part tonight is that we have just recently added the aerial and the acro balance group, and I feel like it's a really big opportunity for us to broaden our performance skills and abilities. This is an aerial trapeze rig. It was made in Colorado and shipped here. It weighs about 600 pounds. It's a lot to bring here and set up for us, but it allows me to safely and effectively perform aerial acrobatics on location. I've been training for a long time to build up the strength and choreography to do the show tonight. When you're up in the air, it's really exhilarating and it's so much fun, but it does take a lot of physical strength to make it look beautiful and hopefully effortless.
I spent 12 years twirling baton, and I went to the World Championships when I was 17, and I won 2 gold medals. It was those 12 years of baton twirling that helped me build all the choreography that I know now, and also inspiration from other dance artists. There's a lot of safety precautions. You have to make sure that the clothing that you wear is all made of natural fibers, and if you use synthetic fibers, you have to spray it with a flame retardant.
You always have to consider your environment, what your costume is, who's around you, how crowded it is, audience, how close is the audience. There are a lot of situations where fire isn't appropriate or you really need to work closely with your fire department and with your event organizer and with your performers to make sure everything goes off smoothly.
To be able to cross over and do both fire and leave it exciting, but also be able to add in a lot of really intricate work that you wouldn't normally be able to do without the fire makes it for a really great performance. We want to make sure that people know that fire can be scary and intimidating, but anybody can try it, and you don't necessarily have to start with fire.
I think after a while it sort of becomes second nature. It becomes a part of how you perform. I've been performing for many, many years, so part of that just comes with your performance experience and being able to read the environment and read the crowd and just having a really good time and making it fun for the audience too.
Coming up tomorrow night, we'll have an interview with the founder of the Southern Poverty Law Center, which has been working for civil rights since the 1970s. Also, many students born in the United States are suddenly finding themselves in Mexico. We'll explain. I'm Tony Paniagua from all of us at Arizona Public Media. Have a great night.